Rob. Thank you.
Thank you, Michael, and thank you everyone for coming to watch this today and listen to us speak. A big thank you to Michael and obviously his medical colleagues there across the continent. This is such a pressing matter for everybody that's got a congenital heart defect, and there are lots of questions. I'm not qualified to answer most of those, so I'm going to be quiet in a minute, but I just thought it'd be worthwhile setting the scene from a patient organization perspective. So if this shares, I think my screen should be shared now. So this is a proper storm in the minds of many congenital heart patients, and they're in a very worrying time. So what does that mean? There's general confusion, I think, amongst the patients about what this means for them. They're getting mixed messages from different organizations, different representative groups, and from hospitals. We have this concept in the UK of shielded and at-risk individuals, and what the difference is and why some people have fallen into one category or another has made a lot of people anxious. And there are questions out there as to whether I've been correctly categorized or not. Have mistakes been made? And we do see some patients changing, their status has been changed once someone's questioned it. I think there are real concerns over whether they should be attending hospital, either from a COVID-related perspective, if they've got the signs of the disease and it's mild, or whether they're attending the hospital for some other reasons. And I also think there's real fear about the future of their services, and especially their doctors and nurses. There's a very close relationship between many patients and their specialists that look after them, and I think there's genuine concern that they may well fall sick, which I'm sure is a concern that their doctors and nurses also share, but that's also playing on their minds. And the fifth area is delayed planned interventions, and the suitability of clinics being run by video, which is something which is now starting to happen for obvious reasons. So these are the sort of 5 broad key concerns. Hopefully the discussions today will address some of these. From a charity perspective, and it's probably worth throwing this in because we are the main charity, in fact the only charity in the UK representing adults, and our demand is greater than ever, whilst at the same time we're seeing mixed advice out there, so it's not as clear cut. There's not the time available for people to consider these things like they would have done previously, so that creates more requests for information. From our point of view, it's difficult for us to reach clinicians because they're busy for obvious reasons, but that means a delay, more delays, more anxiety, etc. We're also in a position where our own staff have got their own challenges. We've had to furlough people, we've had to restrict hours. As you'd expect in a charity, they're not actually reducing the number of hours they work, but all these things are pressure, and they're working remotely. So they're not together in the same office, they're having to work by computer, etc. And that starts to disconnect various things. And as a charity, we've got no income. That's a problem that charities are obviously suffering with across a whole range of services, but no income, maximum demand, that is a problem. So the answers, and I'll shut up after this slide, is, I think communication is absolutely essential. We've got to make sure that that's clean and timely and precise. We need to speak with one voice. That's a problem when you have hospitals and groups talking slightly differently, and patients will pick up on those nuances for sure. And events like this need to be planned over the coming weeks to make sure that we can keep that communication absolutely smart. So I'm going to be quiet now and pass back to Michael to continue.
Thank you very much, Rob, for your comments. We share some of your concerns, and we are all together in it. And I think the reality of it is this is an unprecedented situation that we are faced with, both in terms of the virus and the pressures on healthcare. And I'm confident that at the end of this webinar, we'll be able to reassure our patients. And as you said, communication is key, and this is the main driver for holding this webinar. So without further ado, I would like to present the background to this disease.